Hello, my name's Tim Ringrose. I'm a hospital doctor by background and I'm CEO of Cognitant Group. I'd like to talk about two things that are inextricably linked. The first is information. We live in the information age and we're all experiencing what's commonly called the fourth industrial revolution. The first industrial revolution gave us mechanization through water and steam. The second brought us electricity with all the benefits of that. And the third gave us electronics. But the fourth is the most disruptive of all. It's all about information and data and how this integrates with the physical world. It's about intelligence. Humankind now consists of billions of people connected by mobile devices with unprecedented processing power, storage capacity and access to knowledge. Artificial intelligence, robotics, the Internet of Things, 3D printing, nanotechnology, biotechnology, it's all transforming every industry and every part of our lives. In fact, every day, we as humans produce 2.5 quintillion bytes of data. That's 18 zeros. And 90% of the world's total data has been created in the last 2 years alone. The digital revolution has the potential to raise global income and improve the quality of life for all of us, rich and poor. But unfortunately, so far, those who've gained from it most have been the well-off. Technology has made possible new products and services, such as ordering a taxi, booking a flight, shopping, listening to music, watching a film. Any of these can now be done online. But the information flow is asymmetric. We create and share a huge amount of data every day to companies like Google, Apple and Facebook. But how much really do we get in return? I'm not suggesting that we want to be flooded with data. No, that would be overwhelming. But I believe that we should be demanding better return on investment from our data. We need more value out of the transaction. But the only thing, in fact, that's been more disruptive in data terms over the last 2 years has been a very small bit of data wrapped into a package only 100 nanometers in size. It's spread across the globe in a frightening fashion and caused the death of nearly 5 million people. This is, of course, the SARS-CoV-2 RNA virus that we know as COVID-19. And this brings me to the second word, health. Now, health is one of those things that we don't really appreciate until we've lost it. The COVID pandemic has dramatically reminded us that our health is our most precious asset. Without it, our wealth, our jobs, our lives become meaningless. The World Health Organization defines health as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So being healthy does not mean we don't suffer from a disease or a condition. In fact, as we all live longer, more of us will suffer from one or more long-term conditions. There are more than 23 million people with at least one long-term condition in the UK, and 70% of healthcare costs are spent on the management of these things. We need to change from the medical management that is reactive and deals poorly with multiple medical conditions to a new model of care that provides care for people with multiple conditions and needs, a personalised approach. The King's Fund developed the House of Care model, which has now been adopted by NHS England, which is based on the principles of proactive, holistic, preventative and patient-centred care. In personalised care, clinicians and patients work together using a collaborative process of shared decision-making to agreed goals, identify support needs, develop and implement action plans and monitor progress. And the House of Care model describes 2 walls or pillars. The one on the right side is health and care professionals committed to partnership working. That means partnership between health and social care and partnership between professionals and patients themselves. That's very important. The second on the left is engaged and informed patients and carers. We need both of these walls to keep the roof from falling in and the whole thing falling apart. But to enable us all to be engaged and informed, we need trustworthy information about our health and treatment. It's a fundamental requirement. Without it, the house will fall down. Now, is that a problem? Because there's so much information available now, we can look up anything online and get answers very quickly. Well, I think that is actually where we do have a problem, and it's a paradox, an information paradox. And the paradox is this, is that the more information that we have access to, the harder it is to actually find the right information to answer our questions or need, and most crucially is information that we can trust and rely on. We have a problem with misinformation, and this has been brought into sharp focus in the last 2 years with the spread of rumours and dangerous mistruths about the COVID virus. One of the most dangerous things that we have to deal with in the model world is misinformation. And of course, its even more sinister cousin, disinformation. That's where it's intentional. I used to think that misinformation was just a bit unhelpful and that something that most people could see past. But it's clear that it's much more serious than that. Misinformation and disinformation cause considerable harm, particularly when it comes to our health. As President Biden recently put it, it's killing people. False information about COVID-19 has been described as an infodemic by the World Health Organization Director General. It's probably the only thing that spreads faster than the virus itself. Misinformation has probably been with us as long as humans have been on the planet, but social media has poured fuel on the flames and enabled false information to spread like a wildfire. Social media and algorithms behind it manipulate us to induce stronger beliefs by showing us information that conforms to our existing views, a phenomenon that we know as confirmation bias. We only have to look at Twitter and Facebook to see the difference of opinion, but confronting people about their beliefs, often done with the best intentions, is almost always unsuccessful and is often counterproductive. We end up with even stronger polarization of opinions and sometimes violence. Confrontation is not the best solution. The Health Foundation conducted an interesting study earlier this year with 1,700 adults to explore what factors were the most likely to make a person vulnerable to misinformation. Was it socio-demographic, socio-economic, or political factors that were important? No. There was no effect of these factors. What they found was that the individuals with lower digital literacy, numerical literacy, health literacy, and cognitive skills are worse at assessing the veracity of health-related statements. And probably most interestingly of all, they found that if a person was presented with accurate information before they were exposed to false information, they were less likely to believe the false information. I believe this raises the really significant opportunity that by developing people's cognitive skills and literacies, we can make a big difference to our ability to identify misinformation. I think there's an urgent need to improve the general public's health literacy and to address health inequalities. We need to radically shake up the way that we provide health information to patients and to the public. The problem isn't just the lack of trustworthy health information. In fact, the quantity of health information is part of the problem. The greater the amount of information that is available, the harder it is to find the right information. But there's also another problem, is that most health information that's published is hard for large sections of the population to understand. A study published in the British Journal of General Practice concluded that about 43% of the UK population, and it's similar across Europe, were unlikely to be able to understand a typical health information leaflet that we produce at the moment. And relying on Google and other search engines to help us find answers to medical problems is not the answer. I believe we need to empower patients with information about health and treatment. We need to provide this in formats that are accessible and easy to understand, and we need to provide this at critical moments in people's lives. Now, one critical moment is during a consultation with a clinician. The vast majority of people trust their clinician, and by that I mean doctors, nurses, pharmacists, physiotherapists, dietitians, and the wider group of healthcare professionals. So the provision of health information in an accessible format at or around the time of a consultation is a unique opportunity to engage a person with information about their health and treatment. The information needs to be personalised to each person's needs, abilities, and particular situation. We've all become accustomed to getting prescriptions for medicines when we're ill or have a health problem. In fact, we sometimes feel cheated if we don't get a prescription. Take the demand for antibiotics for sore throat as a good example. But I think there's something that's much more powerful than pharmaceuticals, and that is good information. So I believe that information can be the most powerful prescription a clinician can make. But the problem is that there's very little time in consultations to provide information and education to patients. A survey conducted by M3 for the PM Society in 2018 found that information is prescribed in only about a quarter of consultations with a GP, and that most of this was by providing a leaflet or printout. With the rise of virtual consultations with COVID, the use of printed information is becoming less and less valuable, so I think that number would be much lower post-COVID. We need a better solution. And that's why my colleagues and I developed HealthyNote. HealthyNote is a platform that enables people to receive information that's been recommended to them by their clinician. It allows a clinician to quickly select information that's relevant to a particular patient's needs and make it available by text message, email, or even a QR code on a document. It works to complement the consultation, whether that's face-to-face or virtual, and provide each patient with an information prescription that's been designed just for them. This can include information about their symptoms, medical terminology, diagnostic procedures, etc., and also can include recommended apps. HealthyNote is already being used by over 12,000 GPs in over 1,700 GP practices across the UK. The feedback we're getting from patients is that they really appreciate that their doctor, nurse or pharmacist has made the effort to provide relevant information to help them. In fact, it's not just about the added value for patients, but it actually saves time for clinicians. And even more importantly, it can help patients to avoid unnecessary exacerbations of their condition and to reduce the need for urgent consultations with a doctor, whether that's in general practice or the emergency department. And this system also works well in secondary care for patients attending clinics and is already being used in several NHS trusts. As an example, patients referred to the renal clinic in West Berkshire are provided with a digital information prescription even before they attend the clinic to help them understand what to expect and to understand some of the background information about their kidneys and what chronic kidney disease means. This is enabling the clinic to make use of virtual appointments more effectively, improving the convenience for patients, saving time and reducing waiting times. This is just the start of the revolution of health information. We have so much potential to use technology to improve the health literacy of the general population, to empower people with information and allow them to make truly informed decisions about their health and treatment. To achieve this potential, we need to provide information that's personalised, trustworthy, easy to understand and impactful. We can use tools like AI to drive personalisation based on data from the medical record, data from the wearable device and their previous interaction with health information. We can make the information easy for people of all ages and abilities to understand, using visual techniques to provide interactive, immersive content, even virtual reality and augmented reality. Our smartphones are really powerful devices and can show us data in all these formats. So what about those who don't want to use technology or who just want to be told what to do? Well, of course, there are a whole spectrum of needs and expectations amongst the population. Each of us is unique and we need to provide information in different formats. For some, perhaps the printed format is preferred. But if we are to enable our health services to keep up with the demands of the 21st century, we need to use the tools that other industries are already making effective use of and embrace digital. The pandemic has shown us that we can be much more agile in the way we develop therapies and vaccines for new diseases, but it's also shown us the benefit of these can be undone by misinformation and disinformation. Providing patients with drug prescriptions is important, but it's not enough. Every consultation should include an information prescription. As a GP friend of mine puts it, no medication without education. Of course, we need to find better drugs and treatments, but the most powerful prescription a clinician can make is information.